Welcome to Med-Surg Mini number 20 on rhinitis and rhinosinusitis. To start off, rhinitis is inflammation and irritation in mucous membranes after exposure to allergens. These allergens can include environmental allergens such as mold, dust mites, cockroach droppings, weeds, trees, or animal dander. It could be based on food. The most common food allergies would be peanuts, milk, nuts, eggs, and wheat. Or it can be a reaction to medications, more commonly ACE inhibitors, Viagra, penicillins, and NSAIDs. Rhinitis can be perennial or seasonal. Seasonal means that it happens around the same time every year. It can also be allergic, related to those exposure to allergens, or non-allergic, which is also called the common cold. Then rhinosinusitis is inflammation in the nasal and paranasal cavity, in particular the maxillary, frontal, sphenoid, or ethmoid sinuses. It starts off as an upper respiratory tract infection, but some type of blockage, either from a deviated septum, facial trauma, or vasodilation, redirects the drainage to the nasal cavity and causes the infection there. The cause may be bacterial or viral, and the different types are acute, which would be less than 4 weeks of infection, subacute, where the infection lasts 4 to 12 weeks, or chronic, where the infection lasts greater than 12 weeks. Symptoms of rhinitis would include a headache, fatigue, sleep disturbances, cognitive impairment, itching, sneezing, nasal congestion, and rhinorrhea. To diagnose rhinitis, we can do skin allergy testing to identify any triggers for the symptoms, and then we would also diagnose it based on their symptoms. Rhinosinusitis includes symptoms such as purulent nasal drainage, nasal obstruction, facial pain, pressure, and fullness, especially around those sinus cavities, fever, fatigue, dental pain, cough, ear pressure, cellulitis, and abnormal eye movement. It is also diagnosed on symptom basis, but we can also do a CT or an MRI to see if there's inflammation in the sinuses. Management of rhinitis would be symptom relief, so we could provide antihistamines such as Benadryl, Claritin, and Alavert, nasal spray such as Flonase, Astelin, Afrin, and saline, corticosteroids such as prednisone, or decongestants such as Robitussin, Mucinex, and pseudoephedrine. If we believe it's a viral infection, we can also provide antiviral medications. Rhinosinusitis is treated based on the cause. So if it's a bacterial infection, we would provide antibiotics. If it's a viral infection, we could provide antiviral medication. For pain relief, we could provide analgesics. We can also provide antipyretics, decongestants, anti-inflammatory medications, and saline irrigation. The saline irrigation can be done through something called like a neti pot, and with that, we are pouring liquid into the nose, and then it flushes out the sinuses and drains out the other side of the nose. A couple of things to keep in mind if you're doing saline irrigation is not to use tap water, because tap water can contain infectious materials, and then you're just putting more infection into the sinus cavity. So it should be done with sterile water. Complications of rhinitis would include alterations in comfort and risk for infection, and main nursing problems for rhinosinusitis would be pain and also risk for infection. Nursing considerations for rhinitis would be to assess for proper vitals, respiratory and nasal drainage, and we would educate them on the medications, allergens, and preventing spread if it's due to the common cold. Rhinosinusitis assessment would include vitals, head, eyes, ears, nose, and throat assessment, and sinus percussion. Education would mostly be focused on how to properly do that saline rinse. That wraps up our discussion on rhinitis and rhinosinusitis.